On the road, in the gym, at a coffee house. No matter where you listen, this is Prevention Perk. I'm Steve Miller with Mid-America PTTC. It's time to perk up our prevention efforts. Our guests today are Kim Freese, Region 7 Administrator for SAMHSA, and Catherine Satterwhite, Region 7 Health Administrator for the Office of Assistant Secretary of Health. And we're exploring the recent Missouri Overdose Prevention Planning Strategy. Welcome, both of you, to the podcast. Kim, you've been a guest here before, but can you remind our audience of your path to prevention?
Hey, Steve. It is great to be here. And I would say my path to prevention, in just a few words, really started from my early work in the field, working in a facility, a community-based facility that was focused on treating and providing services to women and their kids, and so families that have addiction. Addiction definitely affects families. And so we were providing treatment and recovery support services, and we were also providing prevention services, which we collaborated with a local agency to come into our center and provide prevention services for both the children that were in residence with us, but also with their moms. So kind of this family focus, and really saw the benefit of, as families heal together, kind of closing that circle and bringing prevention into kind of that heart of healing. Was very, it was a natural connection. So that's kind of how I come to the prevention side of this work.
And Catherine, welcome to the podcast. Can you kind of describe how you followed a path to prevention?
It's probably not so different. So hello, thank you so much for having me. It's probably not so different than Kim's. When I was younger, and it feels like younger and younger these days, I just sort of realized that I was passionate about preventing things before they happened, instead of, the much more severe consequences that can happen later along the lines. My background's public health. So I early on had an interest in actually infectious disease and reproductive health, when there's a lot of important prevention activities around those. But moving forward in my career, I've come to realize how much more important it is to think about prevention holistically.
You're listening to Prevention Perk. As a reminder, SAMHSA is the funder of this project, along with all the other products of the Mid-America PTTC. Did you know that SAMHSA has an opioid overdose prevention toolkit available free for download? We'll put a link for this resource in the show notes, or search SAMHSA, Opioid Prevention. We'll start with Kim. I think it was back in about the summertime in 2022 that you kind of approached me here at the PTTC about this unique collaborative experience to kind of try and set the stage for an overdose prevention strategy for the state of Missouri specifically. So can you kind of talk a little bit about how this whole process kind of got started?
Absolutely. Like everything that we do here in Region 7, we do it together because things work better when we work together as collaborators. And so Catherine approached me and said, hey, we've got the public health side of Missouri interested in creating an overdose prevention plan as additional funds come into the state. This was related to the opioid settlement in this case. And so we started brainstorming and thinking about, we must have behavioral health at that table. So we had to have, that side of the equation, of course, with public health. And then, we just kind of branched out from there, in thinking about who needed to be involved in something like this that would be a comprehensive approach. So I naturally thought of the PTTC as we went through that process. Steve, because you all bring people together, you are conveners in our region. And we've had such great experiences with Hugh Life, one of your contractors, to facilitate complex conversations with large groups of people and get us to a place where we all can kind of build consensus on difficult topics, public safety, public health, behavioral health, all of the community involvement in addition to the state level involvement. The overdose crisis is a complex conversation, but we need a comprehensive approach. And so when I asked you all to join us in a facilitation role, and then you brought Hugh Life to that table, that just was, I think, really helped us. It was really a great catalyst for what turned out to be a great conversation among 100 plus stakeholders in our state. So appreciate that.
Well, Catherine, yeah, you're welcome. Catherine, so Kim's already kind of illustrated there's kind of the behavioral health side, and then there's the public health side. And so we all kind of collaborate in some way, shape, or form. But I think that through your lens, you had kind of a unique perspective on maybe from the outset, like, why was it so important to have this partnership process convening from both sides of that lens, if you will? Why did you think that was imperative for this process?
So one of the things that I do in my job, actually, not unlike you, is bring people together who have similar interests. And sometimes people come from a slightly different place, but they're actually all trying to end up in the same location or with the same outcome. So like Kim mentioned, we do this a lot across our federal partnerships in health and human services in Region 7, which includes the state of Missouri. So it was actually relatively easy, top of mind for me to think, well, the first thing I need to do is recognize that public health is much bigger than the Department of Health within a state. That's thinking about the whole person. There are a lot of people who touch our population at different points in their lives. So reaching out to SAMHSA, to Kim, was a very easy next step for me. And it's something that we've really tried to model in Region 7. And what we do, we want our states and we want our locals and we want everybody to be at the table, because we know that, we've heard it before, that you're better together. So public health has a lot of passion. People who are traditionally in the behavioral health people have a lot of passion. And I was honestly thrilled that we had the opportunity to do this for the state of Missouri, and that they not only were open to it, they were interested in it. So it was, a remarkable process throughout the whole, from the genesis of this idea to the execution. And I'm really excited because I think that we've got the momentum to take it further.
Yeah, I was glad to be a part of this process. I was, kind of coming into this. I think that the two of you have kind of, worked together in the past, but thinking about how many people were going to be at the table and how to be comprehensive and inclusive was kind of a daunting idea to begin with. But if you'd have gone through it at a fast pace, it's pretty fascinating how it turned out the way that it did. It really was it was a remarkable experience to be a part of it. And Kim, you've already referenced that kind of that partnership that we have with Hugh Life. And I think it's kind of important to note that they were instrumental for kind of setting the stage for a question that really helped to guide us through this 2-day process. And it's kind of a lengthy question, but I think that it will help the audience to kind of hear what we were working through. Now, this wasn't Hugh Life just helped shape it. It really was all these different players at the table at the time that really came up with the question that reads, what can we do over the next 5 years to unify and create sustainable collaborative partnerships across systems, local, state, and federal agencies, leveraging resources and data to increase equitable access to prevention, treatment, and recovery supportive services in a combined effort to save lives? Now, it's that last line that we're all really most intent on, in order to save lives. But really, to actualize something like that, it needs to be pretty comprehensive and equitable as far as the gathering is concerned. And Kim, can you talk a little bit about how that was accomplished?
Yes, I think that was a key in how successful this endeavor has been so far. So we created a planning committee that really was comprised of the state of Missouri's public health and behavioral health leadership. The CDC Foundation has two folks in each state that come from a public health perspective and a public safety perspective. Plus, there was Catherine and I, kind of, the federal level, and then Steve, you, and Hugh Life, kind of all of us. Did I forget anyone, Catherine, in the planning committee? Yeah, so that was this planning committee that was, going through this process of how do we achieve, a result to that question that we ultimately decided was really what we wanted, that involves federal, state, and local level folks from a public health, behavioral health, and public safety perspective. And so each of us having kind of our own groups of stakeholders that we primarily do work with, we just started listing all of the stakeholders that we could think of. You name it, related to the overdose crisis from a public health, behavioral health, public safety, CDC Foundation, federal, state kind of perspective. And then the localities were brought in through kind of the Opioid Settlement Commission that our DMH, our Department of Mental Health colleagues were working on. So getting that local voice to the table. So we each listed all of our stakeholders, and then we tried to, unduplicate that list. We actually came up with a list of about we tried to limit ourselves because we knew the room could only hold about 100 people. We started with a list of about 150. And then Steve, you all sent out invitations to that list, and we ended up, with almost right at 100 people that were able to join us for a 2-day gathering to address that topic from the, various perspectives. Really,
I think it worked pretty seamlessly. Yeah, I think it was, again, I think it came across very, very well. Catherine, for the audience, let's kind of unpack it a little bit. Like, what was some of the sessions like, and how were those sessions kind of played out so that it ultimately led to a 5-year plan?
Hugh Life did a remarkable job of creating an atmosphere that was safe. As Kim mentioned earlier, this can be a very charged discussion. People are coming from a lot of different experiences, both personally and in the place that they work, or in the space that they are professionals in. So Hugh Life created a space, and it was a very engaging format. There was, I would say, 90% of the entire 2 days was spent in discussion with people you maybe hadn't known before, or maybe people you got to know very well over the 2-day period. So they really structured it in 4 parts. In the first morning, they came in talking about that question, really framing us on this is a shared vision. And so you mentioned saving lives. So we're all here because we want to save lives. And there are lots of ways to do that. But that's this sort of rallying point that we can all get behind. And thinking about that, what do we want to see in place in the next 3 to 5 years as a result of the actions that we're going to outline in this meeting? Then, because this is really important, it's really easy for people to think about barriers and get stuck on barriers. So actually, the afternoon of the first day was spent, what's blocking us? Really taking a deep dive into the barriers, allowing people the opportunity to express their challenges, to get it out there. And so everybody could hear, again, because people are coming from different perspectives. And then day 2, we came back thinking about what innovative, substantial actions are we going to deal with to address the underlying contradictions that we talked about the day before and move us forward. So we've got it out there. Now let's move forward. And then we wrapped up in the afternoon, getting down into specifics, because what we really wanted out of this meeting was for people to walk away with actions that could be accomplished and a plan to accomplish those steps. So that's what we left with. We left with, I think, with people feeling energized, but also walking away with thinking about what they were going to do over the next year. Because it's, even though we were really looking at a 5-year time frame overall, that's a big thing. So what are we going to do in the next year as a first step?
So as you were kind of recapturing those 4 different sessions as they were laid out, I'm kind of curious because I know how it kind of impacted me. Now, after we kind of looked at those barriers and then those underlying contradictions, there was kind of this, I don't know if it was a heaviness to it all, but you could tell it was like everything was kind of out on the table, if you will. And then they did this little activity where they had everybody spend about 10 or 15 minutes putting together kind of a very brief skit, if you will, a poem, a play, something that would kind of capture, how they were going to get over this obstacle, so to speak. And for me, it changed everything. I mean, it was almost like the air was lighter in the room. And I'm curious whether either of you had that same experience.
Well, I'll just jump in since Catherine just did such a great job summarizing the work over the 2 days, and say the group I was involved with was very much an energizing moment. To our group created a logo that really showed a picture of, meeting people where they are and not leaving them there, taking them with us, to the next place, meeting them where they are, respecting wherever anyone is in this journey toward health, toward living the way they want to live, a meaningful, purposeful life, meeting them wherever that is, and then, but not leaving them there, helping them get, some type of positive change. And then, lastly, I'll just say one of the groups did an actual skit that really was impactful at the end, that really addressed the equity issues that we have in Missouri. We know that Black and brown people are dying at way greater rates in certain parts of the state, especially north, St. Louis City. And we know we've got to do something different if we expect for that to be different. And there was a skit that just gave voice to that need. And there was so much acknowledgement of that need for equity and equitable practices, and what are we going to do different to address those needs, that, I think that was very moving for me, and I've heard for others. So
I think that's true. And that skit in particular was, I think, a real catalyst and a very important moment in that meeting. And I also just want to say, I think people did a remarkable job at this meeting of being willing to be uncomfortable. And that's hard to do, I think, both uncomfortable in listening to others who may have a different opinion than you, uncomfortable in really looking at some of our equity issues head on, and uncomfortable in participating in ways that they might not have wanted to, or may not have been doing a skit. It was that entire group participated in that skit. And Hugh Life again, really just, I think, created a good opportunity for people to engage.
I think it was after, not that there was anything unsettling about the process, but I really think that was a catalyst for everybody when we were able to what it kind of came around was when everybody came together, for these skits, it really kind of brought it home, I guess. And it really illustrated how effective collaboration can be amongst a group of very diverse individuals. That was my understanding. And I think it sounds like from the way you both are describing it, you kind of walked away with that same impression.
Steve, can I make one more comment,
Sure.
just sort of related to this? And so I do want to acknowledge, I think the partnership and the diversity of the participants was remarkable. And I'll just say it wasn't perfect. I think we did a good job of having important people there. And it's always, I think, healthy to acknowledge that we could have had more voices at the table who might have even provided some additional important perspectives. But that was also acknowledged by the participants in the meeting, which I think is healthy and a critical part to this process.
You're listening to Prevention Perk. Learn more about opioid prevention on the HealtheKnowledge platform. They have 25 titles to choose from, including 2 Spanish language courses, topics to assist special populations, and a whole lot more. It's free to sign up. Visit healtheknowledge.org. So, if I were in the audience, and I am, so to speak, I have a natural question. What next? Either one of you could try to answer through that if you'd like.
I'll start and just say, we have our planning committee, just to be very operational. Our planning committee has a follow-up meeting scheduled in the next several weeks where we plan to kind of look at the notes that Hugh Life will produce for us about this convening. So Hugh Life, not only do they facilitate a great conversation, they also document that. And then they will send us that document, which won't have analysis. It'll just be the notes of what happened during that convening, what folks said during the convening. So we hope to take that and look at, okay, how do we take this document, this kind of initial plan to the next stage, which for me, part of that has to include, how do we have kind of how do we form? And when I say we, that's like the royal we, if you will, it's really the state of Missouri. How does, Missouri, its state, its localities form a governing body, if you will, to ensure that this is a living plan? Because things change, people change, funding changes, priorities change, heck, the substances on the ground change, and they're just getting more and more dangerous. We have to, make sure that this comprehensive plan that we've started has a vehicle, to continue living and growing and evolving with, the crisis. So I think that's our, our challenge, our next step, which will be, like I said, kind of our first after the fact post-mortem meeting after the event is in a couple weeks, and then we'll see where we go from there.
And one of our roles as federal support in this space is to adapt our role as is helpful to the state. So if that's just having regular touch points where we can hear what they're doing from a federal perspective, if it is creating the space that we created for the planning committee, we can do that. So I think the big thing is, we do want to make sure that we are talking regularly over, like, moving forward to continue to adapt and figure out how we can inject momentum in a certain area if it needs it, how we can continue to make sure partnership bonds and the relationships that we're forged in this meeting are sustained. So I'm very much looking forward to it, but I just think I feel really optimistic that this is going to be a positive, fruitful step.
So I want to give you both a chance to kind of share maybe some parting thoughts about the process. I think maybe just as important as maybe why do you feel like collaboration on the issue? And Kim kind of touched on this, the collaboration on overdose, because you said, the drugs of concern kind of change. They change with, generation, so to speak. Why is there such a need to focus on that collaborative aspect?
So I can go first this time. So just in general, first, I want to give a huge shout out. The state of Missouri was open and innovative, and Kim and I set up a place, but they showed up. So all the people at that table were there to make the lives of Missourians better. And that is saving lives, like we talked about in the beginning, but it's also making lives better. So I think it's a tremendous testament to the state's workforce and all the people working in the field of harm reduction and behavioral health, that this is such a priority. So I wanted to give that shout out, and actually I'll pass it to Kim.
So, I think, like Catherine, it's our obligation, it is our job to figure out, who does the state of Missouri need us to be? What can we, what power do we have to assist in what they came to us to do, which is to create a comprehensive, transparent, equitable, collaborative plan, strategic plan, so that they, in as much of a participatory process as possible, are optimizing the funds that are coming into the state and localities to address this crisis in a way that allows, flexible and a living, moving, evolving, transparent plan to achieve some outcomes. And what a great point. Yes, we want to save lives, but we also want to better lives. It's not just saving lives. Yes, there's urgency around our need to save lives because the substances just seem to be getting more and more dangerous. For instance, we're often not even just talking about overdoses now, we're talking about poisonings. The drug supply is contaminated with, changing substances. It was fentanyl, and now it's xylazine, and now there's, the next one is, that is our new normal, if you will. And so how we support the state having a living, breathing plan so that they can, optimize their resources for improved outcomes for the people of Missouri. And I, like Catherine, was very heartened to see, it wasn't, lots of people showed up for this process, but the leadership of the state was there and committed and involved the whole time. And that is, extremely encouraging. In addition to, we had some legislative presence. We had at least one, Senator Holly Rader was there with us. So, good commitment and lots of hope for Missouri.
And speaking about, and how we continue to need to adapt when thinking about overdoses and substance use and poisonings, there is still, and this came up repeatedly in the meeting, a lot of opportunity for education at the very front end, recognizing what addiction is and why people struggle with addiction, how people struggle with addiction, and what people need to live healthy lives physically and mentally. So we really talked a lot about the spectrum that is substance use. So it's really important for us to acknowledge that. And the other thing I'll say, Hugh Life asked this question, and it's been, when I've talked about this meeting, it's really sat with me, what did you come with and what did you leave with? And it was remarkable to hear that some people came in with pessimism. Not everybody was maybe sure that this is where they wanted to be, but everybody left with excitement. And it wasn't just words, it was action, body language. So it really was remarkable to see some of that gradual transformation over 2 days.
I can't thank you enough for being allowed to be a part of that. I always appreciate the ideas and perspective that Kim brings to the projects we do with the PTTC, but to ask us to be a part of this was really quite an honor, and I appreciate that opportunity immensely.
Well, it wouldn't have happened without you all as a resource, because Catherine and I do not have those skills. We have lots of skills. We can, do some convening, but to actually do the facilitation, you all were instrumental. Couldn't have done it without you. Very, very grateful.
Well, it's been a great opportunity, and thank you, Catherine Satterwhite and Kim Freese, for being my guest today on the podcast.
Our pleasure.
And thank you for listening to Prevention Perk, a podcast from Mid-America PTTC. To learn more about our innovations, visit pttcnetwork.org and look under Your PTTC for the Mid-America link. Remember, prevention is better together, and together, we are stronger.